Maya Bowers, scanning the room. Hi, my name's Maya Bowers. I'm going to be your APN for today. How are you?
Good, how are you?
Good. Is it all right that I perform an abdominal exam on you today?
Yes.
Okay, so first I'm going to have you go ahead and lay down then. And I'm just going to lift this up a little and that down a little, and I'm just going to take a peek and look at your skin and your contour and the symmetry of your abdomen here. Just going to look from all angles. Okay, perfect. Your abdomen is symmetrical. There's no visible masses or bulges. Your umbilicus is midline without protrusion. Your skin looks smooth without any scars, striae, rashes, or dilated veins. The contour is flat. No visible peristalsis or aortic pulsations are noted. Next, in part of the exam, I'm going to just listen to your bowel sounds. Okay, it's audible and normal active in all quadrants. Next, I'm going to listen to your spleen and your liver. First, your liver. Now your spleen. I'm not hearing any friction rubs, so that is normal. The next, I'm going to use the bell of my stethoscope here and listen for any breweries on your aortic abdominal artery. Your renal arteries. Your iliac arteries. And your femoral arteries down under here.
I want bingo.
Okay, I did not hear any breweries on any of those locations I just listened to. The next place I'm going to listen to is your epigastric area and right over your umbilicus. Alright, I did not hear any venous hums when listening, so that is normal. Next, I am just going to percuss your abdomen in all 9 areas. So I'm just going to use my finger and just do some tapping here. Alright, I heard remember that it's mostly tympanic throughout with some scattered dullness over some of your solid organs, which is normal. The next thing I'm going to percuss is your liver, and I'm actually going to be measuring it as well. So I'm just going to come over here to this side. And I am just going to start from the bottom here and percuss up until I hear. Okay, I'm just going to put a mark right here and then start at the top. Okay, I'm doing a mark here. And then I'm going to measure with my tape measure right here. And I think that's about 6.5 centimeters. Okay. The next thing I'm going to percuss is your spleen. So I am going to have you, I'm going to Okay, I'm going to have you take a deep breath and hold it for a minute. Okay, you can release. I'm hearing normal tympany, and which indicates a normal size spleen. Next, I'm just going to lightly palpate your abdomen in all of your quadrants here, so just some light palpation. Tell me if anything is hurting. Does that feel okay?
Yeah.
Okay, now I'm going to do some deep palpation, so I'm going to push a little bit harder here. Again, tell me if anything is hurting. So you will feel a little bit uncomfortable, but you shouldn't feel much pain.
Okay.
Is this hurting?
Nope.
Okay, that is great. I'm not feeling any masses in there. The next thing I'm going to do is palpate your liver's edge. And what I'm going to do is feel right here down by your ribs border here. And then I am going to kind of like hook my fingers under and see if I can feel your liver's edge. So what I'm going to do is first have you take a deep breath. And then I'm just going to feel. You can release. Okay. I did not feel your liver's edge, so that is normal. The next thing I'm going to do is palpate your spleen. And I'm going to come back onto this side here so I can get a better hold. I'm going to place one of my hands under your back right by your ribs. And I'm going to kind of lift up your ribs just a little bit and then also press down on this side. And then I'm going to be feeling for your spleen. Alright. So I'm pressing down. I'm going to feel for your spleen. Okay, I am not feeling your spleen, which is a normal finding. The next thing I want to do is try and feel for your kidneys. So again, I'm going to place my hand under your back and then again on the top. I'm just going to see if I can palpate them. Okay, I'm not feeling your left side here. Let me try the other side. Alright, I am not feeling your kidneys there, so that is normal finding as well. The next thing I want to do is have you sit up and face the wall over here. I am just going to be using a blunt percussion to over your kidneys, and I want to see if it is causing you any pain. I'm going to go ahead and give it a tap. Did that hurt?
Mm-mm.
Other side here. Did that hurt? Okay, good. That is a normal finding. Now I'm going to have you lay back down again. I'm going to be checking for ascites, and in this test I'll be using some percussion, and then again I will have you roll onto your side when I tell you, and then percuss again. I'm going to get the mid over here.
I need to go potty.
Okay, go ahead and roll over here onto your side for me. I'm going to percuss again. I am not hearing any sound pattern change, so that indicates that the test is negative and there is no ascites. Some of these next tests are for appendicitis, and I know you just had hip surgery, so we will do our best with what we can do here. The first test is the Rovsing test, where I'm going to be pressing on your left lower quadrant here, and I'm going to press and then release really quickly, and I want you to tell me if that causes any pain on your right side over here. So I'm pressing, releasing. Okay, good. That is a negative test there. The next one will be a little hard. This is the psoas test. You would normally lay down on your left side, and then I would pull your right leg back towards me. But again, since that hip surgery, we cannot perform that test. But I would be looking for any pain behind your right, any pain. Okay, the next test would be the obturator test, where I would have you lie flat, and then I would lift your left leg up and turn your ankle away from you, and I would be looking for any pain there as well. But again, hip surgery, I cannot perform this test today. The very last test I have is to check for cholecystitis, where I'm going to try and palpate your gallbladder here, and if it presses up against my hand, it will hurt. So I'm looking for no pain there. Okay. So I'm going to have you take a deep breath, and then I'm going to press, and then you can release. Was there any pain there?
No.
Okay, that is perfect. That concludes our exam today. Thank you.